Hello, and today I'm here with Debbie Williams. She's got quite a long bio because she's got multiple qualifications, but I think it's important that we hear this because there's some great stuff here, and I think we'll see more of Debbie. Let's put it that way, because we're just scratching the surface today. So Deb has amassed over 30 years of invaluable experience in the realm of health and well-being. Currently serving as a bereavement support worker, Deb transitioned to this role 2 years ago after dedicating 18 years to working as a drug and alcohol recovery worker. Her journey in the health industry began in the realm of fitness, becoming a personal trainer and qualifying to accept referrals as part of a GP exercise referral scheme. That then led on to the NHS and where you worked as an exercise specialist in the area of mental health, and also worked in the outpatient day unit for the elderly, on the elderly and adult wards, and worked in organic service and on the substance misuse inpatient unit. So I know that you hold lots of certifications that showcase this diverse skill set. You're a certified instructor in the Buteyko Breathing Method, which is what we're going to talk about today.
Yes.
And that's a specialized approach to breathing re-education. You're also have a diploma in forest bathing, something I came across in Costa Rica last year.
Lovely.
And you're a qualified mindfulness teacher and also trained in nature connection and natural mindfulness as a
Yeah.
guide.
Yes.
You've taught dancing, Tai Chi, circle dancing, and women's self-defense. So, drawing from your experience also in the Buteyko breathing method and mindfulness, you've now combined these practices to enhance the physical and mental well-being of your clients and yourself. And more recently, you need another string to that bow. So you've had a peek into Polyvagal Theory,
I have.
and now you're able to weave that into your work, so that what you do is polyvagal informed. I think that's going
Yes.
to be our next one. But for today, let's focus. It's great to have you here.
Thank you.
It really is. And let's focus on the Buteyko breathing method. I think we're going to start with functions of the nose, aren't we, Deb?
We absolutely are. Yes. The functions of the humble nose. As I say, it's not there just to hold our glasses on.
Yeah. Good job we got one now.
Absolutely. Yes, absolutely. Yeah. Yes, I think, the breathing, well, the way we breathe is underestimated or even not thought about. We do breathe between 20 and 22,000 times a day, as in that's how many breaths we take, and unconsciously. So it's not given a second thought. But so it is part and parcel of the autonomic nervous system. But having said that, it's actually, I think it's the only part that is part of the autonomic nervous system, but also what we can actually control as well. So
If we're mindful.
if we're mindful, yes,
Yeah.
absolutely. So Buteyko, it looks at getting people to breathe low, slow, and deep. Okay, so and light, and that's because a lot of people actually overbreathe. So they might have got sleep pattern disorder, and often that comes about if you've got an underlying illness in the first place. So Dr. Buteyko, when he was in his third year of studying to be a doctor, he discovered that people that were sick breathe through the mouth on the whole. And this is fast, shallow breathing. And it's upper chest on the main. But this was actually feeding into their illness.
Right.
So he got people to slow the breathing down. And the way he did that was by basically getting them to close their mouth. So that's because you only breathe through two little tiny holes rather than a big gaping hole. that, and instantaneously adds another dimension to your breathing, and puts a load on your breathing, so it slows it down. So slowing your breathing down then meant that you wasn't over breathing, and it actually helped relieve some symptoms of underlying illnesses. So he first brought it on board with regards to asthma, and was extremely successful at helping people who suffered with asthma. So the nose isn't just for sort of smelling. It it slows our breathing down. It supports the immune system, because in the nasal cavity we produce nitric oxide, and that's sort of our first line of defense against pathogens and allergies and viruses. It also is a vasodilator, so it also opens up the airways and the bronchi. Nitric oxide that is nasally produced only lasts sort of a couple of seconds as we sort of breathe it in, and it helps the lungs. Okay. We also produce nitric oxide within our body through our metabolic system, and that's really important as well. But we're talking about the nasal sort of nitric oxide. So it also, breathing through the nose, supports a good sleep. So it helps with sleep pattern disorders and snoring, sleep apnea. And the reason being, again, it's about training ourselves to close our mouths and breathe through our nose. So if you were to try, so if you're snoring, you've got your snorers have the mouth open, so it's like, but if you were to close your mouth and snore, it's like this. But part of Buteyko is to train people to breathe light. So if you try and snore through your nose while you're breathing light, it's difficult. It's difficult, yeah. So it stops all that sort of vibration, yeah, and because there's too much air going in. So close your mouth while sleeping gives you a good quality of sleep. There's lots of negative health sort of impacts of having sleep apnea and sleep pattern disorders. So yeah, it also influences. Sorry.
I mean, I'm thinking of my husband, and I've been wearing earplugs to sleep for 20 plus years.
Right.
Because he snores.
Right.
But I'm pretty sure if I said to him, close your mouth while you're sleeping, he'd say, I don't know I'm doing it. So how do you do that? How do you?
Well, it's funny because most people don't know they're doing it, and it is their sleep partners that recognise that they've got an issue sleeping. Let's put it this way, or as in when they're asleep with the breathing. But let's put it this way: if you were in the daytime walking through the streets or in a shop or whatever, and you went, somebody would say something to you, and they said, "Don't you think you better get that seen to? Go to the doctors."
Yeah.
It is, honestly, people underestimate the huge negative impacts of sleep apnea and sleep pattern disorders. And it would always be, I would always advise somebody to go and get a sleep study done. Because, not going into sort of too much depth, there's 4 phenotypes of sort of sleep apnea or sleep pattern disorders. There's 4 different types, and it's often that people have got a bit of each, actually. But without sort of going into that, that can be looked into, and it might be that somebody needs a CPAP machine to help them with with the breathing. But then again, CPAP machines come in a full mask for mouth breathers, or sort of nasal for nose breathers.
Yeah.
And full mask, there's only like 50% compliancy.
Yeah.
Whereas a nasal,
I can't imagine getting a good night's sleep with a mask on.
No, that's the thing. So, if you can train somebody to nasal breathe, then the CPAP machine is brilliant.
Sorry,
As in the nasal one.
the red devils or whatever they're called have just flown over. Did you hear that?
No.
We're a live recording, so there you go. Very amusing. Sorry.
Wow, I didn't, it's fine,
Gone now.
absolutely. So yeah, so I do advise anybody that's being made aware that they're snoring to actually see the GP. I genuinely do.
Yeah.
You could try I've gone slightly off kilter here, but we could
Yeah.
try there's a tape you can use that goes around the lips, called Mayo tape. And so it actually goes around the lips. I've got it's upstairs, actually. I could have brought it down. It goes around the lips, so there's gaps, so you can still drink and talk. And so some people are frightened if they're,
Yeah.
full,
Yeah. Yeah.
they could have past trauma, who knows? So, you've got to be sensitive to these things. But that will help hold the lips together. So once the lips are held together, the tongue has a brilliant resting position at the top of the mouth, which opens the airways. And so you won't get all that sort of sound of, the loose throat. And it's just things, it stops breathing. And so they'll measure, stopping breathing will be measured. And if you stop for more than 10 seconds and so many times, then they grade it. And you've got to remember that every time you sort of stop breathing, then you're not getting oxygen to the brain. So it has sort of long-term effects. So yeah. So just going back to the nose as well, the nose warms the air as you breathe it in, and it filters the air, as in, because the mucus and the nose hair captures any sort of debris and pathogens and whatever. Absolutely. And as you breathe out, it captures. Oh, it also moistens the air, but as you breathe out, it also captures some of that moist and warm air, ready for breathing it back in again. So when you're breathing in, it's filtering the air for the lungs, warming it, and obviously it's moist. So you're not drying your lungs out, which again, so most people who've got some kind of underlying illness, even if it's not respiratory, if they're breathing through the mouth, they're drying the lungs out, then there's inflammation, and then there's narrowing of the airways, and so forth and so on.
And you mentioned oxygenation.
Yes, yeah, that's it. So if you're drying your lungs out, they're not going to be as elastic. So nasal breathing supports elasticity of the lungs. It also supports diaphragmatic breathing, because it's you engage more of the diaphragm once you close your mouth, because there's a connection there. So diaphragmatic breathing means that you're getting the air down to the bottom of your lungs, and there's a good oxygen perfusion. In other words, if you're breathing light and upper chest, a lot of the oxygen is at the top of your lungs rather than down at the bottom, and it's where you start sort of the down the 16, the sort of the bottom 16 branches is where oxygen is taken out into the blood, and then into the organs and cells and to the brain. And so it's important to get that the air is down as much as possible. And the other important thing about nasal breathing, especially, it's not just when you start you notice it because you've only got two little holes, is there's a buildup of carbon dioxide, which is people say it's a waste gas, it's whatever, it's waste gas, it's whatever rubbish, but it's not. It's absolutely, it's so important, so important. So there's a slight buildup of that. So just bear in mind that when we're breathless, it's not a lack of oxygen. It's actually a buildup of carbon dioxide, because carbon dioxide is our main driver to breathe. Okay. Your saturation of oxygen would have to go down to about 50% for oxygen to be the sort of the driver to breathe. So when we're feeling breathless, it doesn't mean we're lacking oxygen. It means that we're sensitive to, or overly sensitive to, carbon dioxide. And this can easily happen when we've got a respiratory condition or other illnesses, if you're over breathing through the mouth, because when you breathe through your mouth, you're blowing a lot of carbon dioxide off. So you're not building up a tolerance for it. So again, so when you close your mouth, you're not blowing as much off, because you're only breathing through your nose. And so it might be that, I feel like I need to take a deeper breath, a bigger breath, or so in Buteyko, it's training people to engage with that tolerance, but at a level that suits them, because again, we don't want to induce panic attack in anybody, which it could do. So you have to be really sensitive to each individual, of what their background is. Them sort of be trauma informed. You don't be sticking tape over somebody's mouth if that's been an issue for you. So we've got to be sensitive in that respect. So the importance of one of the importance of carbon dioxide, if you've got that slight build-up in your blood, there's what we call the Bohr effect. Christian Bohr discovered this, I think it was 1904. And if I'm wrong, somebody will correct me.
There's always that person.
There is, and that's fine, because this is how we, it's how we roll, isn't it? And what he discovered is that more oxygen is released from hemoglobin into your cells, your organs, into your brain, in the presence of carbon dioxide. So the fact that you might well be feeling slightly breathless, you will actually be releasing more oxygen into your body.
Yeah. Just touching on, again, mouth breathing. Certainly in children, this can have quite a profound effect on their development, can't it?
Absolutely.
From the shape of the mouth to
Yeah.
their development.
Yes. And that's because, well, the tongue itself, I think it produces sort of like 500 grams of pressure every time you swallow. So as you swallow, the tongue pushes up to the roof of the mouth. So like as you develop, so breastfeeding is really important, because that puts the tongue in the right position for feeding. It trains the swallow, and again, it helps with the development of the face. So a child having their mouth closed and the tongue is pressing up at the roof of the mouth, it means that the roof of the mouth is going to open sort of that way. And so then naturally you can have room for all your teeth, whereas, we have lots of children having to have their teeth taken out because their mouths are too small. Well, it might be that they're mouth breathers for one reason or another, and it could be that they've had they could have had a cold or anything, and we need to sort of teach them to blow their nose and then close their mouth again.
But we don't necessarily, we've never really associated this, have we?
No,
With
that's
how
it.
the mouth is forming.
That's it,
as we grow.
absolutely. Yeah, absolutely. So it's so important. The tongue position is so important for that, because also if the tongue isn't there, the jaw drops backwards. So if the tongue is at the bottom of the mouth, because the mouth breathing, the jaw drops backwards, and the roof of the mouth becomes like that, more like an arch. So that then encroaches into the breathing cavity.
Right.
And so the breathing, so that's restricted. So that's even harder to breathe through your nose.
Yeah.
And there's other issues like adenoids, etc., etc. So there might be some sort of physical reasons why children are struggling to breathe, but that's to have that looked into. But the most important thing is if they have adenoids taken out or tonsils, whatever, for whatever reason, if that's what needs to be done, they need to go back to nasal breathing. Otherwise, unfortunately, they're still going to end up with a high palate.
Yes.
And then a small mouth, and the jaw back. The jaw back also then encroaches on the airway.
Yes.
And so it's a
fascinating
bit of a vicious circle, really, in that respect. Absolutely.
So the four main principles of BBM, Buteyko Breathing Method. Let's call it BBM.
Yeah, absolutely. Okay. So the four main principles is, first and foremost, is nasal breathing. So even if you weren't sort of doing, so Buteyko is a set of exercises. So even if you weren't sort of doing the main Buteyko exercises, which is there to train you to breathe as nature intended, really.
Yeah.
And not hyperventilate. Nasal breathing, I would just, if that's all you did was to close your mouth, that's what I would say do.
Yeah.
Because you've got to breathe anyway, so you might just breathe with your nose, with your mouth closed. Yeah. Just to say, if some there's lots of people with sort of septal defects where it's out of line and they can breathe, oh, I can't breathe through my nose, it's blocked, or, you know, I've got a defect.
Yes.
On the whole, people generally can, but we can sort of test that by getting them to see if they can breathe through the nose sort of for 3 minutes. And if you can breathe through your nose for 3 minutes, then we say you can breathe through your nose for life. But there might be a bit of training there. So that's sort of a physical reason that might make it a bit difficult. So yeah, so breathe through your nose. The other one is to breathe light. So that's training people to breathe, well, like I was earlier about snoring. So it's the volume of air coming in. So breathing light is going to lessen turbulence, and so it'll lessen volume in the lungs. So again, breathing light will bring the volume down in the lungs, so you're not over breathing in that respect. Yeah. So so the other one is also then to breathe slow. So that gives time for gas exchange, and that includes nitric oxide to do its job and carbon dioxide to do its job. So breathing slow, and again, it helps with diaphragm. You know, it helps bring the air down into the bottom of the lungs, and breathing fast itself actually feeds into the autonomic nervous system, and tells the brain that you're not safe.
Yes.
Because that connects with more upper chest breathing, fast breathing, and shallow breathing. So breathing slow, it helps calm the blood pressure down and the heart rate down. So it tells your body that you're safe as well.
I remember listening to somebody a while back, and they were saying, you know, these days we breathe, I don't know, X number of times a minute, whereas historically and naturally we should be like breathing a fraction of the times a minute. And it's going back, like you say, it's going back to as nature intended, isn't it?
Yeah, absolutely. I think the sort of the average acceptable is somewhere between 12 and 17 breaths a minute.
Yeah. Whereas if you stop and actually try and think of that time,
yes,
lots of people will breathe a lot more than
I think
that.
it's more common to have it more up in the 20s somewhere.
Yeah.
To be honest. So as I said, slow breathing relaxes the mind. So it's not I've got to say we do teach cadence breathing, which is scientifically it's been shown that it's really good for relaxing the mind and bringing calmness, and it actually trains you to breathe slower. But it's not something that we expect you to do, which is 6 breaths a minute. Well, it's actually 5.5, but that's a little bit harder.
Do the half?
Yeah, that's it, exactly. So, you know, research has shown that it's 5 seconds in and 5 seconds out. And obviously we'd be saying nasal breathing. And that research shows that that's the ideal. I tend to kind of do 4 seconds in and 6 seconds out, because it's good to have the out breath, because the out breath is a relaxation breath. It connects with the vagus nerve and the vagal brake, and so it slows everything down, the out breath. So if you can make that 1.5 to 2 times longer than the in breath, that really works. So we're saying sort of 4 seconds, 6 seconds, 4 seconds in, 6 seconds out, to get 6 breaths a minute. But again, we've got to be mindful that people starting out just aren't going to do that. You're just going to frighten them. It's like starting anything.
Yeah.
You know, you don't want to frighten them off, and you'll be saying there's a possibility if they suffer from anxiety and panic attacks, you know, it's going to have a negative effect on them. So it's got to be what the person can do. You know, so it might only be 3 seconds in and 4 out, and then 3 and then 5, and then you sort of lengthen it. Or it could be 2 and 3, or 2 and 4. It doesn't matter. It doesn't matter in that respect. But that practice itself isn't a traditional sort of Buteyko exercise, but it is very useful.
Mm.
And it's something you'd only practice for, I don't know, about whatever suits you really, but say about 4 minutes if you can. But it's not something we're aiming for people to do like 24/7.
Yeah.
You
Do you
know.
know, I will do that if I'm struggling to sleep. If I'm in bed, I'm struggling to sleep. I can tell when my breathing's at the right place that I'm going to fall asleep.
Yes, and
And by practicing that, if I am struggling, I can get myself into the right rhythm.
rhythm, yeah, yeah.
It's
And if you're slowing your breathing rate down from what you were actually doing, you'll get a build up of carbon dioxide.
yeah.
So not only are you know, getting more oxygen delivered to your body, carbon dioxide itself is actually a relaxant.
Mm, yeah, you can feel yourself
Yeah.
relaxing
And
as you do.
so, you know, if you start feeling, if you start getting sort of watery saliva in your mouth, that's one sort of indicator that you're doing it correctly, because that's rest and digest, which means you're
Right.
bringing the autonomic nervous system down.
Yeah.
And the other, if she's feeling a bit tired, because
Mm,
buildup of carbon dioxide does do that.
yeah.
Yeah.
Fantastic. So we've got nasal, we've got light,
Yep.
we've got slow,
Slow. And last one's deep. The
deep.
last one's deep. So it's not big, it's deep.
Yes.
Okay. So it's diaphragmatic breathing. Again, that is to get the oxygen and, well, air delivery down to the bottom of the lungs. So that's teaching diaphragmatic breathing.
Mm,
So, that is one sort of standard sort of exercise for Buteyko. So, and we say deep rather than big because a lot of people take a deep breath and it's like,
yeah. They feel that. Yeah.
and all they're doing is filling their upper chest.
Yes.
People taking it, in Buteyko, it's about actually not seeing anybody breathe at all. You know, you wouldn't know that they're
Yeah.
breathing.
Yeah.
My partner's often tapping me and poking me and saying, "Oh, I was poking you last night. I thought you
Still
died
alive. Yeah.
because you weren't breathing." I thought, "Well, I'm sure I were because I woke up this morning." But yeah, so that is what, you know, and again, diaphragmatic breathing also helps with things like back pain because it's the biggest breathing muscle, and you know, it's part of our core muscle group. Um, um, and it's obviously attached to your spine, and it helps with
Mm,
posture and helps support the spine. So if you're using your diaphragm, you're training your diaphragm, which does actually help with
mm.
supporting the spine and the back.
Very interesting. My daughter will be interested in that. She tends to struggle with a back pain.
All right,
Um,
yes. So
yeah,
yeah, it does help with posture. Yeah.
definitely. So what's the control pause?
Right. So the control pause is it's a simple test that we use in Buteyko. It's also my teacher is Patrick McEwen. I don't know if you've heard of him. He's uh, he's actually quite well known out there in the breathing world.
Right.
And he brought it. Well, he's really sort of brought Buteyko across from Russia because he trained with Dr.
Okay.
Buteyko. I'm not quite sure. I think it was might have been in 2000 or so, because he had asthma himself and he read about Dr. Buteyko and he brought it across here. But he also now does Oxygen Advantage. I don't know if you've heard of that.
No.
Right. So they use a similar score, but they call it the BOLT score, which stands for Body Oxygen Level Test.
Right.
So it's Body Oxygen Level Test, and I thought so that kind of maybe explains it a little bit better than control pause, I suppose. But control pause is the original sort of name for it, and so that's a measure. It's a simple measure of somebody's sensitivity to carbon dioxide.
Right.
The reason being is that that reflects how it will reflect how they breathe. So if you're very sensitive to carbon dioxide, you'll breathe faster,
Right.
basically. And if you breathe faster, you're more likely to breathe through the mouth. It's not a given, but you're more likely. It's more typical.
Yeah.
It's more typical that you breathe up a chest because you're breathing faster. You breathe shallow because you're breathing faster. So that's what the control pause is. So basically, and it is tried and tested, and it's not perfect either. Okay, but it's about measuring how long you can comfortably hold your breath for on the exhalation before you feel the first urge to breathe. And the first urge to breathe will be that sensitivity to carbon dioxide.
Right.
Yeah.
Interesting.
So I'll sort of demonstrate. So you'll take so you'll be breathing through your nose, just breathing nice and steady through your nose, and then you'll take a normal breath in, a normal breath out, and you'll pinch your nose and hold. And then as soon as you feel the first urge to breathe, and that might be, I don't know, movement in your throat because you're breathing muscles in your throat. It might be sort of a kind of a twitch in your stomach from your diaphragm. And then you just so you count in seconds, remove your hand, just breathe normally, and you should be able to breathe normally within a breath or two.
Yeah.
Because if you like can't
Yeah.
can't get back to nasal breathing or whatever, then you've over-egged it, and that would not be a true measure. And the reason to do it on the out breath is because that's more equitable, if you like, because we've all got different lung capacities. So if you're doing it on the in breath, somebody's got, guys have got bigger lungs than
Absolutely.
women, and within those parameters, we've all got different size lungs anyway.
Yeah.
And then there's the ego that comes in.
Yes, I can hold it the longest.
Yes, yeah, and that's not what we're after. That's not what we're
Yeah.
after. We're after the sensitivity to carbon dioxide. So that will indicate, when you need to breathe. And so a low control pause would indicate high sensitivity to carbon dioxide, which would indicate that there's a strong possibility that that person has got some kind of breathing pattern disorder.
Yeah.
And it might be that they're hyperventilating. It might be that it's because they're asthmatic, or it could be that they've just got into a bad habit of breathing.
Yeah.
Which a lot of us get into bad habits of breathing.
Yeah.
And
I
so
think it goes back to when you said at the beginning, we do it without being conscious, don't we? So it's
absolutely.
very easy to fall into a bad habit and
Yeah,
not
yeah.
recognize it.
Yeah, absolutely. And it just then feeds into, well, ill health, to be honest, because you're not getting the oxygen delivered to where it needs to be. It's like 20% of the oxygen is utilized by our brain.
Mm,
And so if you're not getting oxygen to the brain, that's where you might feel that you've got lack of clarity, lack of focus, lack of concentration, sort of
mm,
foggy brain.
mm.
So you can improve all that. All that's improved from nasal breathing and getting your control pause up. Because the
Yeah.
more tolerant we are to carbon dioxide, the more we can allow carbon dioxide to be with us and help us deliver the oxygen to where it needs to be. And carbon dioxide itself helps also to open up blood vessels. So if you open up the blood vessels, then you've got more flow of blood to your cells, to your organs, to your brain.
All good stuff.
So it's all good stuff. And you don't need as much oxygen as you think. Again, I think the air, 20% of the air is oxygen. And when
Yeah.
you breathe out 16% of that is oxygen.
Yeah.
So if you're breathing out 16%, you've only took 20% of it, we're not needing that much, but we do need it to get delivered to where it needs to be.
Mm, mm.
So the exercises themselves are to work on breathing light, breathing slow, and breathing deep, because the acronym is LSD. To be fair,
Okay.
I know it's just
I'll
so.
remember that now, but
Yes, it is so that we can remember it, I'm sure.
and through the nose.
And through the nose, absolutely. And so it's about building up our tolerance to carbon carbon
Mm.
dioxide, the exercises themselves. And so it's
Mm.
to improve your control pause. So hopefully control pause grows and grows and grows. And so we're looking at a control pause between sort of 20 and 25, and then that is good. That's good breathing.
Mm.
They do actually go up to like 40, then they would expect that somebody hasn't got any dysfunctional breathing whatsoever.
Mm.
But we'd say a good breathing is probably about 25, I'd say.
Yeah.
So yeah, and we'd expect we'd like that to go up sort of 5 seconds every week, really, if you were to be practicing the exercises regular,
And
consistently.
yes, exactly. So, and how can people do that? And how long does it take? What would you say would, if you started consistently doing this, you would see
Right.
improvement?
Well, I guess it all depends on what you've come to this type of re-education for, I suppose, or come to a coach for.
Yes.
If, like somebody who's got asthma, the results can be seen in 3
Mm.
weeks.
Yeah.
Something else. I guess if you've seen somebody who's got who comes to with anxiety, then it's probably a bit longer because there's a lot more to look into with regards to that. And again, you have to be really careful in how you approach it. You don't want to induce like an anxiety attack or a panic attack, and
Yeah.
you don't know
Absolutely.
psychological background. So
Yeah.
there's a lot more to look into, and it's a primal breathlessness, and dare I say it, the feeling of suffocation is a primal fear. And so if we're inducing that in somebody, even though it's a controlled dose and the person that we're working with is in charge because
Mm.
they know how they feel, you still got to be really, really careful.
Yeah. If you just want to improve your breathing for your health and well-being without any associated issues that you may have, if you don't have any, but you just want to obviously re-educate yourself, learn to breathe nasally and get the health benefits. By doing this consistently, would it just take, I don't know, 5 or 6 weeks of practice? I suppose
Um,
it depends on the individual,
it,
doesn't
it, it all depends on the individual because we would like somebody to practice this for about an hour a day, but that you can break that up to sort of 6-10 minute sessions.
it? Yeah.
And breathing light. So breathing is like a three-legged stool. So there's a biochemical side to it, a biomechanical side to it, and there's a cadence side to it. So personally, I would work on the biochemical side of it first, which is the sensitivity to carbon dioxide.
Mm-hmm.
So that'd be breathing light and some breath holds, if that's suitable. You don't always do breath holds with people because sometimes it's just not suitable. If they've got
Mm.
medical conditions that like unstable high blood pressure, unstable heart condition, you wouldn't do breath holds. In fact, you might not do breathe light either. You might just say, well, you've got to breathe anyway, so just close your mouth and see how you get on. Because once you close your mouth and it's sort of 24/7 during rest, during sleep, during activity,
Mm.
you will already be challenging your sort of the carbon dioxide as soon as you start moving.
Mm.
Because carbon dioxide, it's not what we breathe in. I think the air contains 0.04% of carbon dioxide. It's the carbon dioxide we produce because it's a waste product from our metabolism, from moving, from burning energy.
Mm.
So as soon as you start moving, that's why when you exercise, you become out of breath because you've got building carbon dioxide.
Yeah. Yeah.
So yeah, there's some. We would do a full sort of screen on somebody to see where they're coming from and where they want to get to, and their sort of health conditions, etc., etc. It might be that they want to see a GP first to make sure that they're okay to engage with Buteyko exercise. But just at the very least, I would advise, I'd encourage somebody to close their mouth, even
Yeah.
if you're not doing any sort of the traditional exercises. But
Yeah.
yeah, so anybody that's fit and healthy, yeah, they can probably do any of the exercise, I would say. Also, if somebody's pregnant, not to do, especially in the first trimester, not to do any breath holds,
Yeah.
because you're depriving the unborn baby of oxygen.
Yeah. Makes
So you have to be really careful.
Yeah.
Yeah,
Makes sense.
yeah,
Well, it's been fascinating. There's I know we're only touching the surface here, but we can share in the description where to find out more information about Buteyko breathing. But perhaps we can come back and do some demonstrations of some breathing exercises.
absolutely,
Would help
absolutely.
people. I think
Like,
that'd be great.
just before, like I would like to say that women also breathe differently than men.
Right. Another thing we do differently.
Yes, we do. We do. And that's because of all the hormone changes. So, three significant sort of stages of a woman's life would be puberty, pregnancy, and the menopause.
Yeah.
But also, while we're sort of in our sort of birthing years, our breathing changes throughout the menstrual cycle as well.
I think this is our next
So,
topic for
it's a big thing.
discussion. I
It's a big
think
thing.
it's a really big thing, and it's fascinating because we do touch on those different areas of a woman's life cycles, but
Mm.
never have I brought breathing into those
Yeah, and
different
that's to
areas.
do with the sort of estrogen and progesterone,
Yes,
rises
I
and
think
falls.
that'll be a fascinating subject for our next discussion. So yes, if you're listening, look out for that one. I think it'll be a great one to do. Deb, thank you so much
Oh,
today. It's
bless
been a
you.
really, really fascinating insight into this. And, especially I find that, the correlation with the children and the dentistry, and
Mm,
it's really interesting stuff. So, thank you for that. Great
absolutely.
introduction. And we look forward to seeing you again soon.
Yeah, and I know that I've missed loads of stuff out because there's loads of things to talk about, but
Well, we do welcome people, if you're listening, to get in touch, send us your questions, because I'm sure, Deb, you'll be more than happy to answer any
oh,
questions, wouldn't you?
absolutely, absolutely.
But this is really just building the foundations of what is a huge topic. So we will
It
explore
is.
it. We'll deep dive into it. And
Oh, bless you. I want to thank you. Thank you,
no,
thank you,
thank
thank
you.
you for allowing me to spread the good word of breathing naturally, the way
We've got to
nature
do it.
intended.
We've got to do it. So we may as well do it properly.
Oh, bless you.
Good to see you, Deb.
And you, Lisa, thank
Soon.
you very much.